So slide 2, the introduction to heart disease and stroke. As you know, heart disease is any disorder that affects the heart. That's the vessels, the muscles, the valves, the electrical pathways that are needed to have the muscles contract. These are all possible, if they're not working right, possible reasons for heart disease. And there are many types of heart disease. Some include the arrhythmias. Arrhythmias are fast or slow or irregular heartbeats that can alter, slow, or even stop the heart. There's angina, which is chest pain, and chest pain means something. There's something going wrong. It's a form of heart disease. Coronary artery or vascular disease. Coronary is the most common and the main cause for heart attacks, and this occurs when the plaque or the sticky substance obstructs the coronary artery, which reduces the blood flow to the body. Heart attacks or myocardial infarction is when the coronary artery becomes blocked and that area loses the blood supply and it causes a heart attack. Congenital heart disease is an abnormality or a defect that many times is caught at birth, but not always. Sometimes it's found later in adulthood. Heart failure is when the pumping of the heart is not able to meet the body's demands. So the blood, is not enough for the body's demands, which causes damage and weakens the heart. And this is the two most common for heart failure is high blood pressure and heart attacks. Then there's others: mitral valve prolapse, mitral regurgitation, pulmonary stenosis, and there's many more. That's just to name a few. Now, defining stroke. Stroke is a cerebral vascular accident. This is where there's damage to the brain because there was an interruption of its blood supply. A stroke is when a blood clot blocks the blood and the oxygen to flow to the brain, and this stroke is very much an emergency, and 911 should be called. And I'll get into signs and symptoms and further information on the next slide.